Welcome to SkinSide Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to SkinSide Out, where science meets beauty. I'm your host, Dr. Zain, with Heather, Courtney, and Crystal. So today we have an exciting topic. We're going to be talking all about hair transplant. So if you guys may remember, we had talked about hair loss in a previous episode, and we really focused on non-invasive options, including medications, procedures in the office, and light therapy. But now we're going to be talking about the surgical interventions that we can make to help patients feel more confident with their hair. So let's start off with discussing what hair transplantation is. So Crystal, she is a hair transplant technician. So what is a hair transplant?
It's basically you're moving hair from one area, typically the donor area, and you're moving it to another area where, there's hair thinning, hair loss, and it could be different areas such as the front, the sides.
Yeah. And the reason why hair transplantation can work is that areas where we typically lose hair due to hormonal changes and genetics, those are androgen sensitive, meaning that they are sensitive to male hormones, specifically DHT. And due to genetic predisposition and higher levels of DHT, patients typically lose hair in these areas. In men, we typically see that in the frontal scalp and the vertex. In females, you can see a widening part, especially in the frontal scalp. So the interesting concept behind hair transplantation is we are taking hair from the donor area, which is androgen insensitive, meaning that they're not affected by those hormones like the frontal area is. So we can take those hairs, transplant them from the occipital scalp or the back of your scalp, and we can basically put them in areas that are usually sensitive to DHT, and it retains that characteristic. It still remains androgen insensitive. So that's a really cool concept, and it's something that we can take advantage of. Otherwise, if these hairs kind of retain the features of the donor site, the recipient site, then, we would lose hair again because that DHT is still around and still causing issues.
Yeah, I've heard the term like donor dominance, just kind of going off of what you said. So if you move that hair to this area, it's not going to take over that genetic component of the kind of like cul-de-sac look, but it's going to keep that low DHT activity.
Yeah, and interestingly, it's not just the occipital scalp that has that characteristic. We can take hair from chest,
beard,
even pubic hair.
Yeah.
And it works. So it is a really good concept, and it's something that I don't know who first started it, but it is ingenious.
Yeah, and it affects about, I think I read like 65% of male patients will experience some kind of like hair loss or thinning at some point. It's funny, like I just saw John Cena talking about his hair transplant, how he wishes that this was, he would have done it 10 years sooner had there not been this like, I guess, judgment from like media and backlash. And then even Tom Hardy, I saw talking about his hair transplant. So it's more common than you think.
Yeah, and it's come a long way. So this is not the same as decades ago where you got those hair plugs look extremely unnatural. Techniques have been refined. We have a much better understanding of a natural hairline. So, Crystal, I know how important it is to have a natural looking hairline, something that's not super linear. You want some natural like imperfections to make it look more natural.
Yeah.
And a lot of people don't understand that. They're like, oh, I want my hair lowered, my hairline back to when I was 20 and just like full and everything. But we don't realize that there are slight irregularities in our hairlines. There's certain concepts. It's an art as well as a science. So I do think that, having a good hair transplant, sometimes it is very hard to tell between a natural hairline and one that's been transplanted. And that's
There's
like
definitely an artistry to it.
100%. So there are two types of hair transplantation that are commonly referred to. So FUT and FUE. Crystal, can you explain the two?
Yeah, so FUT, which is the follicular unit transplantation, that's going to be where we're removing a strip And we are taking that strip and cutting it into smaller sized grafts. And then we would take those grafts and insert them in the areas that are thinning. And then the FUE, which is the follicular unit extraction, that's typically when we're taking the individual follicles and we're moving them into the other areas. I will say that the FUE is a little bit more popular now just due to the fact that it's a bit more minimally invasive from the FUT. But they're both really great.
Yeah, and you can get great results with FUT. I don't want anyone to think that FUT is not a good option. It was the original option. And we are literally excising tissue from your scalp, like a strip, as Crystal had mentioned, and dividing it into small little follicular units and then transplanting them. However, the downside is that you are left with a prominent linear scar in the back of your scalp. So especially for men who wear short hairstyle, that can be pretty prominent, and people can feel self-conscious about that. However, if you have a longer hairstyle, you can easily cover that up with longer hair. Women typically opt for the FUT option because they don't have to shave the back of their head to get the donor area operated on. So a lot of women, you got a small little strip, it's covered by their longer hair, and you can't even tell.
Yeah, and it's typically like a pencil thin scar, so which is nice. It's not what you would think it would be.
And one of the other advantages of FUT is you can get a lot more grafts, a better yield.
Way more grafts, a lot more density. So it's typically recommended for those that have, let's say 2,000 grafts or more. So much larger case. It would be more suitable for an FUT case.
Yeah, you're really definitely gonna get more bang for your buck with that FUT model. And you can perform more than one. So, typically, we're looking at a small strip. We don't want to take too much because it's much harder to close. There's more tension on the wound and it doesn't look as good cosmetically. So you can do serial transplants and, you can still get a great outcome. And especially for patients who need a lot of hair transplanted, that's the way to go to get the most natural result and also have the minimal comorbidity, the minimal morbidity associated with high tension on a scar.
You mentioned hair plugging previously and how that is not really the mainstay option nowadays, just with that unnatural look. So is the main difference between the hair plugging and the FUE, is FUE you are taking one single unit, whereas hair plugging you are taking multiple units?
So the way that FUE works is we are taking a punch, a specialized punch. Either it is mechanical or motorized, and we are selecting 1 to groups of 4 hairs within a follicular unit and then taking those individually. Whereas a plug, like back in the day, they would just take a large punch, punch it out, and they would take that whole group, literally implant it.
Yeah.
And that's what I saw too, is that you can, decide on how many hairs, like I saw some people doing like even the fine hairs, the thicker hairs, and then even like the triples or quadruples of hair. So
It's dependent on the area. So typically for the thinner hairs, those are usually always going to go into the frontal area. And then whereas the follicles that are 3 grafts, or grafts of 3 follicles or 4 follicles would typically go in the areas that would need more density in.
Yeah. And, the nice or the important thing about this is kind of using those follicular units in a way that simulates natural results. So typically in, the very edge of the frontal hairline, we're using 1s and then kind of mixing them into 2s and 3s as we go back. So it looks more natural.
kind of like lash extensions.
Yeah.
Where they, at least when I learned in school, using like your singles, kind of mixing with your double lashes, things like that.
To be honest, they tell you that those that are really good at lash extensions are typically really good at hair transplants.
They've got good hands, dexterity, they have an eye for it. So it's an art.
I'm assuming for people who have different types or coarseness of hair, like in certain areas, so like the beard, the chest, the pubic area, is that something where you have to avoid like if you transplant that to your scalp, I'm assuming it would still have that same consistency of coarseness.
So with those cases, you would have to spread them out and kind of do a blended look so that it doesn't, because obviously if you're putting them all in one area, it's not going to look right. But they
Natural,
still
yeah.
do it. Yeah, we just spread them out and blend it in.
Okay.
Yeah. And, you bring up a good point. There is different coarseness and curly hair, different ethnicities. And, African American hair, Afro hair, and certain other ethnicities, they have curly hair, and it's a lot more technically challenging to do. You sometimes even use special extraction tools so that you don't transect the graft.
Yeah.
So that's really important. There are some people who specialize just in Afro hair because it's such a niche, market, and only certain transplant surgeons are comfortable treating those type of hairs. So it definitely takes a lot more effort, skill, and dexterity.
Yeah, because it's very easy to transect, especially if you're doing it with an FUE way. And then also they're typically more prone to getting keloids. So that's another thing to consider.
That is true. And with the FUE, technique, we typically see less visible scarring. It's not one single linear scar. We're taking these little micro punches, so you can barely perceive them. They're spread out all through that donor area, so it's kind of spread out and speckled, and it's very imperceptible if done correctly. So that's why it's gaining so much popularity. People basically will have, no visible scar, and they're getting great results. But it's not for every patient, especially, we're looking at more limited grafts with FUE, especially with, single stage kind of cases.
Yeah.
Yeah. All right. So why don't we talk about why people get hair transplants? So Heather, tell me a little bit about hair loss and what type of patients we are looking to hair transplant.
So there are different types of hair loss. Like Dr. Zain mentioned, we do have a full in-depth episode on that. But most commonly it's for androgenetic alopecia. So that's the kind of classic hair loss that you see. So for men, it's usually kind of temple recession as well as in the crown and the top of the scalp. Females usually a widened part or thinning on the top, but also overall thinness. There are different classification systems. For males, we use the Norwood classification. So there are different stages of hair loss. It's staged 1 through 7, and it just kind of depends on the severity of the hair loss. For females, we use the Ludwig classification system. And that is classified in stages 1 through 4.
Yeah. And you brought up a good point that hair transplant is mainly used for androgenetic alopecia. However, it can be used for other forms of alopecia, scarring and non-scarring. So the biggest thing is that if it is a scarring alopecia, we can transplant it only if it's quiet. There's no inflammation. It's been quiet for a while. We can try, transplanting hair, especially if the scalp hair, skin hasn't been completely scarred over. So it's still a viable option in certain cases. So if you have a patient with lichen planopilaris, frontal fibrosing alopecia, lupus, if they're not active and they're well managed, there is a potential to hair transplant. However, if they are active or if they become subsequently reactivated after transplantation, you run the risk of losing that hair.
Yeah, I think that's why a consult is so important and having that history, because even like a biopsy, like a punch biopsy, will be able to show you if that skin is having that inflammation, and that gives you a little bit of intel. And even sometimes, telogen effluvium, which we've talked about previously, where you are having that shedding, a simple hair pull test will tell you if that's really that bulb that's coming out or if that's true, hair loss. So sometimes it's not always what people think is genetic, and there could be other hair losses going on.
Yeah. And we touched upon men and women getting hair transplants. So Crystal, tell me a little bit about the female experience with hair transplant.
I feel like things are you mean like emotional or overall when they
Both.
Okay, so I'll get into the emotional aspect. I will say I feel as though the female patients that I have seen are a bit more sensitive about the subject. It's typically the first thing that people see, and they typically lose it in their mid hairline area. And then that's when they start trying to do the little side comb over effect. You know, no one wants to feel like they're not beautiful. So, but as far as transplants go, I think, well, all the ones that I've done have been really successful. And I really enjoy the after effects when they come in, you know, once their hair follicles start growing back, which typically the first stage of hair growth is within like the 6-month mark, with the 12th month mark being where they are seeing full results. They just light up. They come in and they're just like, you know, oh my gosh, look at these little baby hairs. I had one patient that came in and she could see the new growth in the area, and it's like a little short stubbies, but she's like, it's something there. And they'll get emotional, but it's very rewarding. I will say that hair transplants, it's something that's very rewarding. And just the longevity of things, you know, this hair growth is like lifetime. It's not something that's temporary.
That is an important point to make. So these hairs stay with you for the rest of your life. So it is a permanent form of hair restoration. So it's not temporary like some of the other options we had spoken about in our prior episode, like we have to maintain it's a chronic condition. These hairs will retain that ability to grow and stay healthy there. However, that also brings up another point where, yes, those hairs will stay, but the surrounding hair may not. So you have to kind of think of the hairline decades in the future and design it in such a way that it looks realistic as the natural process continues. Even with management, with medical therapy, you're still bound to lose hair over time, and you want to make sure that it looks natural, not when you're 40, but also when you're 60 or 70. And that is really important, and that's part of the art of doing hair transplantation. And, you know, I definitely do see that it's a very emotional, you know, type of treatment. These patients really feel self-conscious. They have really low self-esteem. Their confidence is down in the dumps. And if we can help them and restore that, and sometimes hair transplant is the only option because their hair loss is so advanced. It is really rewarding to see the fruits of your labor, being able to help restore that hairline. Even if it's just improving the density a little bit, it can go a long way. You know, just kind of restoring some of that frontal density for a patient, it gives illusion of much more fuller, denser hair. And hair is such a strong part of our identities. Society places such a big emphasis on, you know, that being a part of your beauty and your youth. So when people lose that, they feel like they're losing a part of themselves. So being able to restore that is just an amazing, amazing experience. Yeah.
So we could probably touch a little bit on, I guess, what to expect. You know, typically you'll go in for your consult. The actual treatment requires numbing the scalp. Typically they'll do that with injectable lidocaine. I know typically when I've numbed, I try to numb through already numbed skin, so it should be pretty tolerable after the first few numbs. But, you know, there's things like Pronox, for example, like laughing gas that can be helpful. I know some patients even have maybe taken like an anti-anxiety medicine before if they're really anxious about the procedure. But it is an all-day procedure as well, so depending on how large the area is and how many grafts that they are implanting, you know, you can be there upwards of 8-10 hours, you know,
and sometimes multiple days.
Yeah. So it's something you really want to, you know, make sure you're prepared for.
Yeah, don't make any other appointments that day. Yeah, I mean, a lot of people are always worried about how painful the procedure is. So Crystal, what has been our patients' kind of experience?
Honestly, I want to say that that's a myth, just because every patient that I've had, they don't really experience any pain. And we are very caring to the point of like, hey, listen, if you feel any type of slight pain, just let us know, because we can just easily inject that area again, and get the numbing in effect rather quickly. I want to say it's more of a discomfort, I've been told. And the discomfort is more so after the transplant. It's a sense of tightness. It just feels really, really tight. And like I said, just really odd, like an odd feeling, but I don't ever get any pain.
Yeah, especially with the FUT. I mean, we're doing surgery, we're doing excision, we're doing a repair.
That's what I was going to ask. I heard the FUE has a shorter recovery time.
It does.
Yeah, just think about it like tiny little punches that don't need to be repaired, and it's a little more comfortable for the patient.
Right. I want to say the complaint is more of itchiness, and then
That's
for
part of the healing
the FUT, it is more tightness because of the scar and the healing. So, and they will just experience the feeling back there,
Yeah.
the pressure.
And patient comfort is really important. So, when we're doing our anesthesia, we're using short-acting, long-acting anesthetics. I'm combining lidocaine with Marcaine. We're buffering our solutions. We're sometimes using an infiltrator to pump the anesthetic in, and we're doing very careful dissection, trying to minimize trauma to the skin. And then when, I'm doing the closures, we look for a trichophytic closure so that we can really minimize the appearance of the scar. And in general, most patients, if you arm them with the information prior, being prepared, having, pain medications, usually Tylenol and ibuprofen is all that's needed. But in case they're more sensitive, they can maybe perhaps use some more longer acting and more powerful pain medicine if they need it, but most patients don't really require it.
Right.
Well, and close follow-up is
we've
really important.
prescribed it to them, and they'll usually say that they didn't need it, they didn't take it. And I mean, they're either knocked out and just sleeping, or they're awake and listening to music or, watching something on their phone. I think for the most part, they're pretty relaxed.
Yeah, and I think the medications along with Pronox, the anxiolytics that we give really do chill them out and makes it a lot more tolerable. So that's key in the preparation, during the treatment, and after, just really kind of informing the patient what to expect. We are big on hand holding. This is a big procedure. Patients really, especially if it's their first one, they have no idea what's going to be going on. So constant communication. We check in with our patients that evening. We check in the following day. We typically have them in the office later that week, the following week, just to see how things are looking, making sure that, everything is healing appropriately. So I think that's part of helping the patient, especially with recovery.
And just to piggyback off what you said, it makes a big difference as far as having it where you're located versus traveling somewhere else and not having that care.
Yeah. So let's talk about that trend of people going overseas, specifically Turkey, to get their hair transplants. We've had a few patients who have had hair transplants in Turkey who came back with complications. So, they started developing some, issues after the transplant. They're back in the States. They can't get in touch with their surgeon. And even if they could get in touch with their surgeon really can't do anything. They can't prescribe medications overseas. So they're like, oh, see a dermatologist here. So we've seen some pretty gnarly cases in the office, some staph infections, HSV. We have seen some necrosis happen as well. So these are all pretty serious complications that not only, are detrimental to the patient's health, but they're also detrimental to all those transplants, all that money you spent, that investment, and it's all going down the tube if it's not properly addressed. So yes, you can get a $3,000 hair transplant with your hotel stay in Turkey. You can check out Istanbul while you have your bandage on, that's fine. But remember, no one's going to be holding your hand when you come back here if you have issues. So I think that, having your treatment, in the United States where there's a standard of care, there's protocols, and there's also liability protection too. Like we want to make sure that you're safe and patients are safe. So you don't really get those protections overseas. So, seeing a reputable hair transplant surgeon, and I feel like dermatologists are uniquely qualified because we not only treat the medical hair loss, but we also understand the surgical component of it. And we can really help optimize results because, there are a lot of great hair transplant surgeons in the country. However, many of them are not dermatologists, and some of them may not have enough knowledge about scalp and skin disease that affects the hair, and they can be transplanting patients that are not appropriate, or they can compromise their results because, for whatever condition that the patient may have, it can compromise the results and viability of the grafts.
So, post-treatment, should people expect to continue their minoxidil and finasteride? I have seen varying answers on
Yes,
that.
there are varying answers. I'm a proponent of continuing. It really does help with viability. It helps stop the progression because those other hairs that are androgen sensitive will continue to lose hair over time if you don't do anything. However, I also understand the other camp where I just want a treatment. I don't want to take medications. If I get a good surgical result and I'm happy with it, I'd rather not take medications. These are particular people who are worried about potential side effects, specifically with finasteride. So I get that perspective too. But if you're able to tolerate these medications, I think it's going to help. I'm also a big proponent of light therapy. So red light, low-level light therapy is very helpful. Nutrition is really important. I'm a big proponent of PRP, growth factors, to really help with stimulation, and taking the correct supplements to really help enhance those results. I think of it as an investment. What I want to do is keep and restore that investment for as long as I possibly can. Any other comments about hair transplant? Well, I think that was a pretty in-depth discussion on hair transplant. I feel like there has been a lot of stigma about it in the past, but I feel like it's much more acceptable. People are talking about it. People are on social media discussing it. And especially with the rise of medical tourism, it's very commonplace now. So I think that patients, first and foremost, need to be evaluated by their dermatologist to make sure that they're being appropriately treated. I always favor non-invasive techniques prior to more invasive techniques like hair transplant, if we can, to preserve as much of your own hair, regrow some of that hair. But I do understand that when there comes a point that, a patient prefers having a surgical intervention, I think it is an appropriate option, especially if there are no contraindications. And there are other options that, don't rely on surgical intervention, especially for advanced hair loss. So scalp micropigmentation is an option. Hair systems are an option. Wigs, things like that can be viable options. Patients can be very happy with natural looking results and restores their confidence. And that's what it's all about. Finding the right solution for our patients and helping them on the journey. So hopefully you guys found this episode to be interesting. I certainly did. And I love talking about hair. That's one of my favorite things to treat. And if you guys have any questions, feel free to, drop your comments, ask us questions. Please like and subscribe. But until next time, SkinSide out.
Thanks for listening. This episode of SkinSide Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Noor Dermatology and Aesthetics. Check us out online at noorderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.